All right. Good afternoon or good morning, depending on where you're joining us from. Thank you so much for spending some time with us today for the second webinar in our Addressing Commercial Sexual Exploitation, a Framework for the Youth Legal System series. My name is Alex Miller, and I'm the Deputy Director for Multi-System Operations here at the Center for Juvenile Justice Reform. So as I mentioned, today's webinar is the second in a series of three. The first webinar, titled Shifting Narratives, Understanding the Complexities of Commercial Sexual Exploitation, took place back on January 30th. Now, if you haven't had a chance to check it out yet, you can find a recording and related information on our website, and the web link for that will be coming into the chat shortly. And so during that first session, we learned about a number of myths and stereotypes that can impede how we respond to survivors of commercial sexual exploitation. But we also learned how to confront those misnomers with facts. Additionally, we learned the importance of stories and why uplifting the voices of survivors, is vital to rectifying false narratives. So for today's webinar, titled Establishing a Tailored Response to Commercial Sexual Exploitation Within Probation Services, our speakers are going to build on that information and take things a step beyond the conceptual to establish the foundation for how real change can be enacted systematically. Today's presenters will discuss the child trafficking unit that was developed within a Los Angeles probation department and the many ways that unit supports young people through multidisciplinary practices, relationship building, and through partner collaborations, all of which happen to be fundamental aspects of our work at CJJR through the Crossover Youth Practice Model, or CYPM. If you joined us for our first webinar, you know that CJJR recently released a request for applications for communities to become CYPM sites. So if you're interested in learning more, please check out our RFA landing page, and that link will also be headed your way in the chat shortly. So on that note, I'm very proud to introduce today's experts. First, we've got Michelle Guyman, who served over 30 years with the LA County Probation Department, and where she was the director of the Child Trafficking Unit. Dr. Carly Durkheising, who's an associate professor at Cal State LA, whose work advances actionable research on topics relating to trauma, dual system involvement, and commercial sexual exploitation of children. And finally, Maria Contreras, an esteemed community policy associate with the National Center for Youth Law, who spearheads the collaborative responses to commercial sexual exploitation of children initiative. And I actually kind of feel like calling these folks experts is genuinely an understatement. They are so much more than that. So before I hand things over, I do want to note that we'll have time at the end of the webinar for Q&A, but please feel free to drop your questions and comments in the chat as they come to mind. We will also follow up after the webinar with a link to the recording and materials. And so now, without further ado, Maria, Michelle, and Carly, the floor is yours.
Thanks so much, Alex. Welcome, everyone. Thank you so much for joining us today. We're very excited to share with you some of the innovative things that Los Angeles County has done to support youth impacted by commercial sexual exploitation, or CSE, who are also involved with probation. I'm Carly Durkheising. Last year, we wrapped up a federally funded project through the National Institute of Justice that was an evaluability assessment of the CSE units in both the child welfare system and the probation department in Los Angeles. Today, we'll be highlighting some of the key resources and practices related to the probation side of that work. As we walk through some of the different topics, I'll drop in a few links to the chat, so if you want more information, you can easily access it. And we'll also have time for Q&A at the end, and you can always drop in questions as we move through as well. We will also provide you with our emails at the end, so if anything pops to your mind or any questions, you can always follow up with us later. I'm very fortunate today to be able to present alongside my esteemed colleagues, as Alex mentioned, Maria Contreras at the National Center for Youth Law and Michelle Guyman, who recently retired from probation, but she's one of those people that retires and then gets even busier. So she actually established the child trafficking unit, and I'm going to hand it over to her to get us rolling today. Michelle.
Thanks, Carly. So wanted to start off the webinar today by just talking a little bit about how the child trafficking unit was established. So late in 2010, I was fortunate enough to be a part of a committee in Los Angeles called the Interagency Council on Child Abuse and Neglect, because at that time I was the director of a girls' residential treatment program. And a lot of the young women in the program had histories of various types of child abuse and neglect. And in November of 2010, there was an FBI agent who came in and shared some information around domestic minor sex trafficking. And that was kind of when I had my aha moment about the issue, that these young people were not criminals and for arrest for prostitution, but actually those impacted by commercial sexual exploitation. And so the court and probation applied for a grant with the state, which was an alternative to detention grant. And because, again, we were learning that, again, these young people were victims of exploitation, we wanted to find different solutions to provide them with services and support and have them do less time in custody, more time in the community with community providers and response. The other thing that we, so go ahead and do the next slide. So when we started, we were awarded that grant, and it was a 3-year grant in 2012. So we began the child trafficking unit in 2012, and also the STAR Court, which was our dedicated courtroom, which we'll talk about a little bit later in the presentation. So in the beginning, there was really just myself, another director who was involved in independent living program for our transition age youth, which were 18 to 21-year-olds. We brought on a supervisor, 3 probation officers, and a clerk. And what we did, basically, a lot of people ask about resources, is we just took probation officers from current assignments and put them into this assignment. So we didn't get additional people positions. We just absorbed them into this pilot unit that we were starting. In 2020, we got to the height of our unit as we began to get more referrals and identify more young people that were coming into the juvenile justice system. Our team began to grow. And again, absorbing staff into the unit and just moving youth cases from other areas of the department into this specialized unit. And so there was a director, a supervisor. I was able to get a staff assistant just because of all the data we were collecting around the issue. Also, we brought on a probation officer to be really focused on our multidisciplinary team and kind of a subsequent court officer to the dedicated courtroom. We also were learning that our young people that were transitioning out of care, our 18 to 21-year-olds need a little bit more support. And so we brought on someone that really focuses on that transition period and also does assessments for services for any young person that come to our attention, which Carly will talk about in a little bit. And then outside of that, we had 8 probation officers who actually carried a caseload of young people that came into the unit. Next slide. Over the years, actually for the first 10 years in the unit, we worked with approximately 821 young people who were identified. They were primarily those identified as females. Again, that's really what we saw. That was what was out in front of us. And I think, quite frankly, in the beginning was really all the capacity we had to take in. But as we started to get into a rhythm and as we started to really work in the unit, we started to look at under-identified, those that we didn't identify as easily. And so we did work with those identified as males, LGBTQ youth, etc. Next slide. Some of the guiding principles around the unit, which, and again, we'll talk a little bit about this as we go through, but one of the things at that point in time, I had probably about 20 years in the department, and one of the primary things that I knew is that relationships make a difference. And so we really wanted to focus on relationships in the unit. And in order to establish those relationships and reestablish trust, especially with a probation officer and a youth, is that I wanted to make one of the foundational principles of the unit is that we keep the case. That means when, I had learned through 20 years of probation that during a year of a young person's probation time, we could move that case 5 or 6 different times. And if we were trying to focus on consistency and relationship building and trust, we couldn't be moving the case every time a young person moved to a different place. And so that was one of the foundational things. I also wanted to develop a solid team because, again, consistency of having probation staff with the team as a team was going to help with the young people too, not to have to transition again from probation officers constantly coming in and out of the unit. And I will say with that principle, most of our staff, I would say about 85% of our staff, from the beginning of when they came in to the end, had about a 10-year lifespan. And so people that came in stayed in and really, really enjoyed the work. We also really focused on youth voice, which we'll talk about. Again, wanted to make sure that their voice mattered and that their ideas about, where they wanted to be and who they wanted to have as a part of their support team and things like that mattered, and that was in the forefront. We also focused on survivor leadership. We knew that we needed to have those with lived experience be in the work with us. And so that has been a very valuable part of our team as well. And then also we'll talk a little bit more about multi-agency collaboration, because again, we knew that we couldn't do this work alone, and it was just going to take all of us collectively in the work to really meet our initiatives and meet our goals around helping and supporting young people. Next slide. As I mentioned, in this unit, we wanted to be different. I didn't want it just to be about probation supervision and conditions of probation and things like that, but the unit was very, very active, and I wanted to be much more than just supervision, especially in relationship building. And so, we acknowledged birthdays. We did a lot of baby showers, unfortunately, but fortunately, and wanted to make sure that all these little milestones were celebrated. Showed up at graduations. Some of our staff you see here on the screen. We had a young lady that was placed at a program in Arizona, and she fell in love with horses. And she was actually the rodeo queen in that area for 2 years. And so our staff would show up for the rodeos to support her. We also attended college tours with young people and helped support 2 of our young people to go through cosmetology school. Also, when COVID hit, we did Fun Fridays where we would drop off, puzzles and things like that and meet young people outside and just do Fun Friday pop-ups, and also, kind of celebrated like Valentine's self-care boxes and things like that. So really wanted to make sure that it wasn't just about an office visit, but really getting involved in being engaged with young people and our collaborative partners. Next slide. One of the collaborative partners that we engaged with early on when we got the grant between the Star Court, our unit, was Saving Innocence, who was one of our community-based advocacy agencies. And again, knew we couldn't do the work alone. And so we wanted to make sure that our model included a community-based advocacy agency from day one. And to have, non-system people involved in these young people's lives. And we'll talk a little bit about advocacy, but they provide parent advocates, survivor advocates, youth advocates. They work with us round the clock and have always been a really great partner in the work. Next slide. And then, as mentioned, the Star Court. A couple of things I will say about the Star Court is Judge Pratt was the original judge in the Star Court. And I can tell you the kids just can't say enough good things about her. And even the dynamics of the court, wanting to have kids come in more often, not because of probation issues, but really about relationship. I remember listening to a couple of young people, before we put this program together, and I would ask them randomly, like, who's your judge? And they're like, I don't know, it's somebody in Long Beach. You know what I mean? Like, it's a guy. Like, they didn't really even know the judge, and they knew Judge Pratt. She was always on the record, off the record, talking about things, showing up for events and whatnot. The whole court courtroom were supporting young people. And she also celebrated birthdays. We had a young person come in to court one day and say, I just want the court to know that my birthday is next month and I want cupcakes. And so it kind of became this tradition about wanting cupcakes, and they wanted the court to sing to her on her birthday. So, you know, Judge Pratt and the court team really made sure that those little milestones were celebrated as well. So I think Cardi's going to talk a little bit more about the Star Court.
Yeah, so, and just kind of taking one step back, these specialty courts for commercial sexual exploitation have actually become quite common. There was a recent review of the literature which identified 21 different specialty courts for CSE, but there are likely many more than that, given that those were just the ones that they found in the academic literature. But this review also found that across the studies, specialty courts for CSE tend to show positive outcomes, such as increases in linkages to specialized services, such as those community-based advocates that Michelle was talking about, improved housing stability, including decreased instances of leaving care without permission or quote unquote running away, improved educational outcomes, and a reduction in new criminal charges. And a study on Star Court specifically also found these outcomes as well. And just kind of to add to what Michelle was saying, from kind of a more personal and anecdotal perspective, there really is a very different feel in this courtroom. And we've heard from young people that they feel that as well. You hear the judge, as Michelle noted, kind of going off the record frequently to ensure that everyone in the room understands what's going on, checking in with mom, checking in with the families that are there, asking them their names, making sure they understand what is happening and that their voices are being heard. The judge is very careful to make space for youth voice and choice by asking youth what their perceptions of services are, for example. Is that service working? Why not? What's going on? What do you not like? Is that therapist not a good fit for you? Is it too far? Are you struggling with transportation? Or asking about preferences around housing options. I've heard Judge Pratt, that's something she asks a lot about, or would. What do you like about that group home? What do you not like? Oh, it's too far from my family. Okay, well, where else maybe are you going to be comfortable? Or how can we maybe try to get you to your family more? So there's just a lot of problem solving and back and forth and family and youth engagement. And young people really speak highly of this court. And when we've talked to them, they say things like, once I realized I could speak up and talk to the judge, everything changed, right? As Michelle noted, like oftentimes the youth are actually never speaking in court. And in Star Court, they're talking directly to the judge, and so are their family members. So it really is a different feel. So I'm going to transition to talking more specifically about this implementation and assessment guide around these specialized units. And I just dropped the link into the chat here. It is a very big document. There's a lot in there. So we're highlighting just pieces of it. So if there's anything else you have questions about, we're happy to talk about that too. And this specifically, this is a glimpse of the logic model that we created of the child trafficking unit as part of that work, that federally funded project. And I know there's a lot happening on this slide, and you can review the guide within the guide, we lay each of these bullets out, every output, every outcome, and we talk about what do we mean by this, and we provide examples of all of these different bullets. But today we're just going to focus on a few of the practices and activities that make the child trafficking unit unique. So you can see on the left side here, the different activities we bucketed them into these 5 different domains. So multidisciplinary teaming is a key critical component of this work, and I'll talk about that referral and assessment process. Relationship-informed care. Relationships are absolutely the foundation of this work as well, and that encompasses a variety of different activities such as youth voice and choice, empowerment, and collaboration. Trauma-informed case management. So things like making sure that services are continuous, that the probation officer is staying with the youth, that we're focusing on goals that are youth identified, focusing on harm reduction, and so on. And then there's the specialized programs such as the community-based advocacy and the Star Court that are really help all of this work that we've already mentioned. But there's also a set of specialized protocols. We don't have we weren't going to go into all these today, but if you have any questions around them, We're happy to kind of direct you to more resources or talk about them in the Q&A as well. But these protocols are in place mostly around supporting youth, but also identifying youth who are experiencing or at risk for commercial sexual exploitation. So we will say this 1,000 times, relationships are critical to this work. Without youth engagement and a strong rapport, the work is simply not as effective. And you can see from these quotes how impactful these relationships are in the feedback from youth. And one of the most important ways that relationships are established is through that continuity that Michelle was talking about. So when a youth is assigned to a probation officer, they stay with that probation officer for the life of their case. And this is not common across all probation settings. As you noted in LA, youth are moving from PO to PO as their living situation changes. And that can be incredibly frequent for some youth who may be filtering in and out of secure facilities and into different homes in the community. Another thing too is that the POs in this unit, they chose to be in this unit. They want to work in this unit. They have to apply to the unit and they're interviewed to ensure that there's a good fit and that there's a true commitment to working with this population, because it is not easy. It's really challenging, but also, of course, incredibly rewarding. These officers, they engage in pretty extensive as well as ongoing training because it is very specialized. And they also engage in a lot of professional development that's kind of beyond the basic requirements of the probation department, broadly speaking. Overall, the relationships, though, are very strong and they're long lasting. Just some of the examples that have always stuck with me, speaking with POs in this unit. There's one person who said she was in the room when one of her clients gave birth. That's a pretty tight relationship. I've also been on a call with a probation officer who was dog sitting for a youth. So there's just some examples just to highlight how really unique and real these supportive relationships are. So how do youth end up being served by the child trafficking unit? So there's several ways that youth may be referred. So there's the first responder protocol. And maybe Michelle, you can, when I get through this, maybe you can just talk for kind of give a brief description of what that is, because it's going to come up a couple times. They might be referred through medical or mental health, oftentimes from probation officers from other units who might be seeing risk for CSE. There's a detention identification protocol as well. So they might be coming from juvenile hall or from other courts. All youth who are referred are then assessed by that assessment DPO that Michelle mentioned. They interview the youth and they look into their case history. They then present to the MDT, the multidisciplinary team that's attached to the STAR court, who then decides what action to take. So you can see there's several options that they have in deciding what to do. And it is really unique to each youth. And another kind of unique thing about the CTU that I just am fascinated by is just the variety of options they have. And youth who may not want to be served by the CTU, because even though they might say, hey, this youth would be a great fit, they're not going to, they still ask the youth whether they want to be transferred into the unit. So they may prefer to stay with their current DPO if they're already on probation. And when that's the case, they can provide what they call secondary support. So the youth can still be provided services and support, such as a link to that community-based advocate, but they may not be formally transferred to the unit. So the CTU continues to review all the cases that are referred to them over time in these MDTs as needed in order to ensure that youth whose situations might change are still being supported. Michelle, do you mind just kind of briefly just saying what the FRP is?
Yes. So back in 2014, when we started the unit, and just the work we were doing in Los Angeles, we were arresting children for prostitution. And before we had decriminalization for children that came in 2017, in 2014, we reached out to law enforcement. In fact, it was the National Center for Youth Law in collaboration with us, and talked to law enforcement about, can we do something different, and with our child welfare partners and community advocates. So basically what that means is we put a protocol in place where law enforcement had a different response than arrest and detention. And so law enforcement, when they come upon a young person that they believe is being commercially sexually exploited, they they engage, they call the child protection hotline. The child protection hotline sends a team out, a response team out within 90 minutes of that call to the hotline. That's 24 hours a day, 7 days a week. And most calls happen between 8 at night and 3 in the morning. So again, being able to be responsive. When the system gets the call, child welfare or probation, depending on the jurisdiction of the youth or both, then we call our community advocates, who again will get up at 2 o'clock in the morning and join us in 90 minutes to that law enforcement station. We will then take the young person off law enforcement's hands, and we will do a crisis MDT, and also work on where that young person is going to lay their head at night. And law enforcement goes back and does their work, whatever they're doing. So it's, and then before we take the young person to where they're going to be that night or that day, we do a medical assessment and then take the young person to where they're going to be. So that's just kind of it in a nutshell.
Thanks so much, Michelle. And also, I'll throw in a couple more links, but there's a couple reports on the first responder protocol for those who might be interested in learning more about that. So I'm going to provide just a kind of a case example here of that referral and assessment process, as well as that kind of secondary support option. So here in this example, a 15-year-old female was identified through that law enforcement first responder protocol at a motel where guns and drugs were present, along with a 30-year-old male. Her mother wouldn't take her home because she was worried about her drug use. Her family had a dependency court hearing coming up, and there was an expectation that she was going to be removed due to a history of abuse by her brother, who was still in the home. And we know from the data in LA that this is really common for youth who are, particularly youth in out-of-home care, and are experiencing exploitation and are involved in probation. They also have a history in child welfare. So when the assessment DPO interviewed the young person denied experiencing exploitation, but the man found at the hotel with her was a known trafficker, and she reportedly went to this motel often. There were mental health issues and developmental delays present, and she was already on probation. So therefore, the assessment recommendation was to reach out to the youth's current DPO to discuss transferring the case to the child trafficking unit based on the concerns related to exploitation. But in the meantime, the MDT was able and decided to provide her that secondary support and refer her to an advocate. So while these kind of other pieces of the case are playing out, if you will, they're still able to provide immediate support and referrals to that community-based agency, even though they're not necessarily assigned to the CTU yet. So again, I just think that's an amazing resource. So I'm going to talk about MDTs a little bit. So multidisciplinary teaming is critical component to this work, and it's also becoming much more common in a variety of high needs cases. So for those of you on this call who work with CJJR, and particularly the crossover youth practice model, you know that this is a best practice for youth involved in both child welfare and juvenile justice. MDTs in this case are led by probation and include a variety of stakeholders and service providers. In California, Senate Bill 855 created an opt-in CSEC program where counties who choose to establish an MDT protocol for youth impacted by CSE can receive additional state funds. So Los Angeles opted into this program, and they have some requirements based on this legislation about who has to participate in these MDTs. So there's often folks from child welfare, probation, mental health, public health, education, those community-based advocates, and attorneys. Importantly, though, the MDTs really spend a lot of time discussing the youth goals, service needs, and really problem solving. When I listen in on these MDTs, it's really about everybody coming to the table with their resources, with their critical thinking skills, and problem solving when a youth or family has a specific need. For example, I've heard discussions, really creative solutions about how can we find housing for a family who's, doesn't have stable housing, so that the youth who's on probation can return home. Discussing childcare needs for a parent who maybe has a young child with like intellectual disabilities, for instance. And so all of the resources are poured into that young kid, but we want to support that family so that they can also pour resources into the adolescent, the youth, right? And just figuring out other creative innovative ways for youth to reach those goals that Michelle was talking about, like visiting college campuses and doing those little things that will help them reach their ultimate goals and reach that, well-being that we want, that we're really shooting for. So I'm going to pass it back over to Michelle. She's going to, if there's anything I missed, Michelle, please add, and then she'll provide another example here.
Sure. So as Carly mentioned, with the multidisciplinary team, we really wanted it to be an all hands on deck approach. And we really wanted to have multiple people advocating for the youth on their behalf and for the youth to begin to create this network of support. So here's a quick example of that. During the multidisciplinary team MDT meeting, the case of a 17-year-old girl was presented following a disclosure she made to the nurse regarding having a pimp during her medical exam at the juvenile hall. The community advocacy agency highlighted the youth's aspiration to graduate high school within the upcoming year, but expressed uncertainty about her credit status due to her multiple placements in group homes. The public health nurse, who also had an opportunity to engage with the youth at juvenile hall, shared that she and the youth would begin devising a plan to address various health concerns in the forthcoming weeks. Additionally, the probation officer shared that the youth's sentiments during the meeting, conveying that the youth said she couldn't believe so many people came to see her and wanted to help, and that she had already received a call from the educational advocate about her credits, which she was really excited about. So really what we wanted to make sure is that the young people don't just count on one person to kind of help them with all of their different needs. And so we really want them to get to know and practice doing that outreach and gain that confidence so they can kind of advocate for themselves with multiple people in their life that can be there for them. One of the quick things that we did is we did a little kind of like a little incentive thing with our young people, and we told them who was on the multidisciplinary team, and gave them some contact information and asked them to reach out and interview their public health nurse and their attorney and the educational advocate and say, what can you do for me, and how can we do this thing together? So really wanted to kind of again build their confidence in doing their own advocacy, but also having multiple people that they can respond to get their basic needs met.
Great, thank you. All right, I'm going to pass it over to Maria now.
Thanks, Michelle. So now I'm going to talk about centering and promoting the child's youth's perspective. And before I go into this, I just want to preface that I have lived experience and I also have a background in direct service. And so I'll draw on those things as I explain why this is so important. And so inclusion of youth, voice, choice, and participation in decisions affecting their lives is one of the few ways that we have of being able to put agency back into a child who's experienced so much trauma. If you think about it, a lot of the time, young people who are experiencing commercial sexual exploitation have had every single ounce of agency taken away, even when they don't identify themselves as having been victimized. Because someone's buying their voice, someone's buying their body, someone's buying the ways that they can live their life. And so little by little, if we start asking young people what they want and what they need, those are the ways that we're going to start restoring that sense of self that will then be able to empower them to do what they want to do. And this is a really common theme throughout interviews and the surveys that Carly and Michelle and my team has done over the years, really focusing on the importance of centering the child's and youth's perspective, and oftentimes also the family's perspective, who are desperate to get their young people the help that and support that they need. And so keeping that in mind, a lot of the time, transparency when decisions don't align with youth expressed preferences is really important, because the reality is we're not going to be able to do everything that the young person wants, right? Like, for example, if the young person wants to be placed with someone who may not be able to have them, obviously there's ways to be creative around that. But if that's not possible, always having a conversation with the young person about why that's not possible is so important. And when I was a young person, I remember one of the most frustrating things for me was when decisions were made without even speaking to me. And yes, oftentimes I was also upset when somebody would tell me that what I wanted couldn't happen, but at least having a conversation, I had time to process those feelings and to really understand the reason why some of the things couldn't happen. And so sometimes I feel like facing our fears of having facing negative feedback or having a young person having an outburst is better than kind of leaving that young person feeling like they don't have any agency over their lives. And so that's really important. And this really highlights that ongoing youth and family feedback mechanisms are critical to being able to support young people and their families throughout the entire time that a youth's case is open. And of course, like Michelle mentioned, some cases may be closed and reopened for various reasons. Oftentimes, these young people have a history of child welfare, but really the goal, and especially for young people who are on probation, is to figure out like ways that you can continue building that relationship and asking the youth and the family what they need and want. And one example that I can think about too is, I know Michelle mentioned and Carly mentioned, the importance of doing things like um, college tours and asking the young person where they are in their school trajectory, like whether they have a desire to graduate high school, all of those things. Oftentimes I would hear things like, well, why are we focusing on that if like this kid is still being exploited? So we need to get him out of that first. That's not what, that might not be the priority for that young person in that moment. So always talking about their exploitation isn't going to get us to build that relationship. For some youth, seeing themselves and being inspired by the possibility of them going to college, even though they're not there right now, might just be the thing that catapults them into starting to figure out what they want for themselves outside of exploitation. Next slide. And I'll pass it over to you, Carly.
Thanks so much, Maria. So I'll just say quickly on this slide, when we were working on the guide that I dropped into the chat there, one of our kind of mandates in doing that work was, once we had developed that logic model, we then needed to figure out a way to assess all of those activities and those outcomes, right? That was kind of part of the process. But so we developed this youth survey to assess some of those things in that logic model. But the other conversations we were having is kind of really to Maria's point is, how can we ensure that we're hearing directly from youth about how things are going, about how services are going, about how they're feeling and whatnot, in order to highlight that youth voice and choice. And so we're really excited about this youth survey because we think it can be used in a lot of different ways, but importantly, in order to get that direct feedback from youth, because it really doesn't happen that often in a systematic way like this. And so the survey was co-developed with youth and others with lived experience. It's free and downloadable Word document. You can use the QR code here, or I could drop it in the chat also, to get directly to the spot where it is in the guide. If you have a problem accessing the actual Word document, you can email me and I can send it to you. And it was, we did that survey. It's assessing these 4 components that were derived from SAMHSA's key principles of trauma-informed care. So youth and family engagement, youth voice and choice, empowerment, and cultural, historical, and gender issues. And we did it from the probation services perspective, but we also know in kind of the preamble around the survey development that it could be adapted for child welfare. It could be adapted for a community-based agency. It could be adapted in a variety of ways by just kind of changing the service provider, essentially, that each of the questions are referring to. So we really are encouraging folks to use this if they're interested in encouraging and getting some youth feedback, and really thinking about systematic ways that you can implement this over time. So maybe you're having people do this on their caseload every 6 months or every few months or whatnot. And also, one thing too that we recommend is you can establish a youth advisory board. And maybe it's that youth advisory board that is collecting this information and then synthesizing and giving that feedback back to the department, for instance. So there's a lot of different ways that this can be used. All right, and so with that, I'm going to pass it right back to Maria to talk about youth engagement.
Thanks, Carly. And so this part is, I highly recommend that you all see this, read this closely. I'm not going to go through the whole sheet, but as we've been saying, youth voice matters, and we want to make it easier for everyone to start being able to engage in conversation with young people and to normalize that. So this is a youth engagement tip sheet. And so as Carly and Michelle have already mentioned, like building those relationships is so important. I can't tell you so many times where like, I had a direct service provider or someone who as soon as I met with them, started asking me questions about my experiences, and that just didn't feel good. There were no questions about like who I was as a young person. There were no questions about what I liked. There were no questions about what I wanted in life. There was really nothing that indicated that yet that person really had my best interest and my best interest as a whole human being rather than as someone who's experienced commercial sexual exploitation on their mind. And so genuinely being curious about who this young person is. And one of the things that I, used to do when I was a provider, that I learned to do very early on, was that the first meeting I had with a young person, I wouldn't read their case file beforehand. I'd show up, I'd introduce myself, and I just asked the young person, of course, if there was a caregiver, I'd ask permission for that too. And depending on like the terms of probation, I'd make sure that I'd ask what we could do. But like, do you want to meet here? Do you want to meet somewhere else? We can go wherever you like. We're just going to get to know each other a little bit. And I'm going to tell you the things that I can do for you. I'd also be very upfront about not having read the case file and just said, I want to get to know you for who you are. And I don't want that to create any bias about, how I'm seeing you. And obviously, at a certain point, I have to read it because I want to know the needs and sort of like some of the things that have already been done and some of the things that maybe have been missed and some of the things that I could work with that young person. But that, in my mind, doesn't have to be immediate. And always ask the youth their perspective first, like going into the meeting and asking, being more curious to actually listen than to respond is so important. And that's, I think we all know this, but like this is beyond like caring for a young person. This is really important in any relationship. And so I find myself really pausing and trying to figure out what I can learn from that youth that might be helpful in their care rather than, trying to listen to a response that I can then respond to, and tell them what to do or tell them that they shouldn't feel a certain way because that's not really going to work. And then I think I touched on this a little bit, but offer communications options. Were kids who would only communicate with me via text. There were kids who, I knew when there was a crisis, they'd always call me. So if I was getting a call from them, I knew that I, needed to pick up as soon as I could, so we could address whatever was happening. Just ask about how they prefer to express themselves. There were also times where I'd go to the child family team meetings or the multidisciplinary team meetings, and sometimes the young people didn't want to be there because it was too stressful for them. So what I would do is work with them so that they could tell me what they wanted me to share about what they wanted during that so that their voice was still present in those meetings. And over time, also working with them so eventually they could be there. And some young people never showed up. I'm not going to lie about that. And some young people did work up to being able to be there and use their voice and not really needing me to express their needs, which is really what we want. Be consistent, show up. If you can't show up because life happens, kiddo gets sick, whatever, you need to call off because you're also important, just communicate with them. They're more understanding that than we often think. And then be transparent. Again, like I think the young people get more upset when we don't communicate about what's happening and why, rather than them learning later that a decision was made without their input. Next slide. And so now we're going to talk about the principles of harm reduction and what this could look like. So obviously, youth voice and choice, we've talked about this quite a bit. So always ask youth and families first what they want and need. And, I've worked with families that don't always have the best relationships at first. But at the end of the day, one of the things that I remember, even when the dynamic is, difficult and annoying, is that parents are working with the tools that they have. So are the young people. And ideally, you'd want to facilitate those relationships for the rest of their lives because they will have to deal with each other in one way or another for the rest of their lives in a way that I don't. And so how do we create that supportive environment? And that's really by including everyone. And obviously, in my mind, the priority is still on the young person because that's about their lives. So then I think this is probably the hardest one. Well, actually, I don't even know which way this goes, but I'm going to talk about balancing risks first. So this is probably one of the most difficult ones to talk about because you have to recognize and accept that risky situations and behaviors happen. Things may go wrong. They may not guarantee safety. And we have to consider all types of safety the youth may be balancing. So for example, you as a provider may say like, in order for this young person to be safe, they have to leave, their exploitation situation. That young person may think that the safety of having money in their pocket so that they can pay for their meals is a bigger priority. They may also feel that whatever affection, that whatever love they're getting from the person that's trafficking them is a greater priority for their safety than anything else in the world. And that's really hard to understand. I've been in all of those situations. I've been, as I shared, I have lived experience. I've been in that situation where the safeties that I thought were my priority that now I reflect on, I'm like, maybe that wasn't the correct thing. But we're not looking for the correct thing. We're looking for the thing that's going to be the priority for the young person. And relationship building. We can't stress this enough. Don't recreate harmful power dynamics. So, for example, like they already have to deal with exchanging things for basic needs like love, affection, food, a roof over their heads, money. Don't start that dynamic with your relationship and telling the kid, if you do this, then I will give you this. You want to, and Michelle explained a great example within the program. You want to have some of those celebrations in place and knowing that the young person can expect those things to be celebrated, regardless of whether they're at in their cycle of change. You don't take away their ability to celebrate a birthday because they had an incident with exploitation or something else. We want to combat the cycle of criminalization by helping youth build safe relationships with supporting people. And you oftentimes may be the only example they have of that. And then focusing on incremental change. So celebrate the smallest steps that eventually increases long-term safety, encourage you to progress at their own pace. That could be a young person going from not going to school at all to going once or twice a week. And celebrating that and really noticing that because a lot of the time I know that the young people I worked with crave just being seen. Like sometimes saying like, oh, I did all of these things and nobody is recognizing it is really hard. So then the goal is to go back to where they are being recognized. And oftentimes the recognitions are negative, but at least something is better than nothing. So really making sure we're celebrating those little steps and also the big ones. Graduating from high school after not having any credits is huge. Make a big deal out of it. Next slide. Oh, after not talking for a bit, now I feel like I'm talking a lot. But I do think we'll have time for question and answer. So these are some practice tips. So focus cannot be on immediate results. I think that goes hand in hand with what I talked about in the last slide, but setting realistic goals and expectations with the youth is really important. We can't expect the young person now that, they're on probation or whatever, and if they had a substance use challenge that all of a sudden they're going to stop that. So, there could be a term of probation saying, like, you're not going to be smoking weed, you're not going to be doing whatever, but that's not realistic. Changing behavior is really difficult, even for us as adults. We have to set incremental changes that are going to be realistic for the young person. And the youth is not a project with requirements, incremental project milestones, and an end date. Like, healing is forever. I am going to be 29 this year, and my last incidence of exploitation, I was 21. And I am nowhere near what I would like to be in my healing journey, if I'm being completely honest. I've come a long way, but we're not projects. And if we are approached as a project with deadlines, with requirements, with all of these things that we need to do, then we know that you're not here because you really want us to heal. It's because you're trying to write up a report, and then move on to the next kid. And that's just not the way this works. And then check yourself and practice humility. I have a really big problem with this one. Sometimes when I was providing direct service, like if something wasn't going well, I'd get down on myself and say, like, what am I doing wrong? Instead of, how can I support this young person better? And so reframing can sometimes be really, really helpful. And then asking yourself, is this agenda mine or the young person's? Again, looking back and saying, who came up with these goals? What does a young person actually want from their care? And that's not like, you may not see any improvement or significant improvement, whatever you define as significant. You may not see this young person leave exploitation. But what we've learned from speaking with young people is that every little bit counts. And they do remember those instances where somebody was there for them. And then resources and opportunities must be offered to all youth. I can't tell you how many times I heard, I'm not going to give this resource to this young person because they're a pain in the butt, or they don't like me, or I don't think they're ready for this, or blah blah blah. And one of the things, and I've honestly been guilty of that in my own practice, and one of the things I started doing so that I wouldn't do that, and unintentionally have a young person miss out on an opportunity, is I just carry a binder with me with tabs on housing, healthcare, reproductive healthcare, all of these things. And during conversations with a young person, sometimes they bring up needs. And oftentimes it wasn't because I asked a question, it's because they're having a conversation with me. So then I just pull it up no matter who the young person was and said, like, let's see if we can find something to meet that need. And that would sort of eliminate some of that bias that we all have. And then acknowledge discomfort. This work is really hard. It's really important for staff to have places where they can talk about hard things, where they can vent a little bit, where they can also troubleshoot. Like, okay, maybe this isn't working. Does anyone have any ideas of what I could do to start moving this young person to a safer place? Next slide. And so this is another example about how to use harm reduction and engagement in practice. So a 16-year-old boy is on probation and is known to have experienced SCE, but the youth doesn't want to talk about SCE. The youth continues to violate the conditions of probation and gets put back in juvenile hall several times. The youth's PO doesn't know what to do to motivate the youth, and every time she brings it up, he denies it or gets angry. The PO asks the youth to come back in to talk about what the youth needs and assures the youth that they don't have to talk about SCE. The youth says he doesn't need anything, but then discloses that he doesn't feel like he has anyone to talk to, and that school doesn't feel like a safe environment because other kids know, quote unquote, what he has done, referring to, having been exploited. And as you can imagine, him being a boy also influences the bullying that he's experiencing. The PO thanks the youth for sharing this information and asks if he would be open to coming to a meeting with his other supports to talk about changes he may want to support him, including potentially changing schools. The youth agrees as long as the PO is there. So the purpose of this example is to show that, like, one reframe is really important. And the way the PO is listening to the young person, even though the youth said, I don't need anything, but then the youth having a conversation and saying, like, this is really hard for me, I don't feel safe here, is important. And the PO kind of just takes that and says, like, okay, I want to hear more. I also want your team to hear more from you, because this is the only way that we're going to be able to address those needs. And that's the kind of relationship that we want to have with all the young people, and also the action. What would have happened if that PO said like, well, who cares? Like, one of the conditions of probation is that you go to school every day, so like it doesn't matter, just suck it up and go. You think the kid would go? Probably not. And things would probably also get a little worse with the relationship between the PO and the young person, because he's not going to be um, probably willing to go back and talk to her again. Next slide. Now I think this is Michelle, right?
Yep.
Okay, so another piece of engagement that we did early on with regards to bringing young people together is we created an empowerment conference where we would every year take our young people, probably about 40 young people impacted by exploitation, and they were all female identified young people, to the mountains where we would camp for 3 days. And this was quite an experience because a lot of our young people had not been camping. We were, in nice places, but in the woods, without cell phone, connections and things like that. But we wanted to kind of have a space where we could all come together and just engage with each other and just have some time away. We also had probably about 10 to 15 adults with lived experience that would be there, because we also wanted to have young people be able to engage with those who have been there and really be inspired by them and talk through some of the things that they really didn't have opportunities to talk through in other places. We'd have a survivor panel usually that very first night where things would get kind of emotional, and then we'd do things like karaoke, and we'd play and have fun, and have some of our survivor leaders also do keynote speaking, and then also do some art, like expressing yourself through dance, spoken word, art, and things like that. And so it was always a really awesome experience and gave kids opportunities again to connect with adult allies and survivor leaders on just some of the things that they aren't able to connect with in other places. And so again, this is still running strong today. And so this is something, like I say, the young people really look forward to. After the second empowerment conference we did, we were kind of debriefing with the youth, and what one of the youth said is they were a little disappointed that we weren't doing an empowerment conference every month. And for those who have ever done any kind of conference planning, it's like 6 months long and a lot of money. So anyway, but we also heard that they wanted to stay connected to positive people. They wanted to be able to experience things that maybe they wouldn't be able to experience otherwise. So next slide. So what we did out of hearing them is we created what we call monthly empowerment activities. And this is where on the third Saturday of every month, one of the agencies in our multidisciplinary team would create some activity where it would bring us all together again, just for a day, a few hours a day of activities. So here you'll see we've gone to the beach, we went bowling, some hip hop classes, self-defense. We went to a WNBA game, went to sip and paint, obviously without the sip. But just really had a lot of fun collaborating and coming together. And again, this really kind of solidifies some of those engagement and relationship building. This is some of the events that our court personnel came to, and so it was kind of fun for the kids to see the judge there, like doing some of these activities, as a real just person, and kind of getting to know her on a different level. So these are things again that really kind of made this more than, again, just supervision of kids in the community. So wanted to highlight a couple of those things. And then we're going to close out this today by just really talking through a couple of lessons learned along the way, because there have been many. So we'll start with the first lesson. Next slide. And I think it's something that Maria just spoke about quite a bit, so I won't belabor this. And it's really just understanding that trauma takes time, and never disregard the impact of trauma on the youth's behaviors. I will say one of the things, as looking back over my 33-year career with probation, I think the first 4 or 5 years, I did a lot of this. did a lot of finger wagging about why are you doing this? Why are you doing that? And really, some of the young people taught me great lessons about, looking underneath the surface, and really trying to understand what's driving behaviors, and this too, and just understanding that this is a process, this is a journey. And I would say just stay consistent and stay committed. I have people, say all the time, well, I've been working with this young people for 6 months and they don't seem to want to change. And I'm like, 7 years, 7 years. You know what I mean? Like, if, and like Maria said, you can't put an end date on it. You can't put a time frame on it, but I think it just takes that time. And I think really what I would always tell my team is we are here to plant seeds. They're going to, if enough people in this young person's life plant seeds, it'll grow. It'll grow. It may not be during our time with them, but kids will always say, I listened to every word you said, even though you didn't think I was paying attention. And so my biggest takeaway from that is to, show up every day, lift young people up, and always message hope, because they need that. They need that kind of inspiration and love poured into them every day. Next slide. And then the other thing, about halfway through being the director of the child trafficking unit, something I always said that if I could go back and start over, I would have put in a self-care program from day one. It wasn't until about 5 months in and everybody's kind of tilted sideways, just because of all the different things that have, taken on around vicarious and secondary trauma, that we really, came in. And it was actually a supervisor that came into the unit, Joanne Para, that really said we need to do some self-care. And so, I would challenge anyone on this call. I mean, we're all in charge of our own self-care, but anybody who is a supervisor, a manager of a unit, that I really took this on. I really wanted to be intentional about this with my team. We did unit meetings around this. I put it in my monthly report. When the staff would turn in their monthly report, one of the questions was, what are your, how are you doing with your self-care goals? Because I really wanted it to come up in every place, because I came away with, if my staff aren't in a good place, the kids aren't going to get the best of them every day. And it really requires all of us to be, at our best. And so really, focusing on that. I remember telling one of my staff who, again, we wanted to be all in, and my staff were all in, but you also need some downtime. So I threatened my staff and told them that I would be sneaking up and calling them from different numbers. And on a Saturday at 3 p.m, if they picked up that phone, they might get a letter of warning. So, obviously in fun, but I really wanted them and young people to understand that I'm on vacation for a couple of days. So call your advocate, or call, and this is how they built other relationships. And if they can't get a hold of me, they start dialing numbers of who they can get a hold of. And somebody's going to show up, or letting young people know I'm taking a couple of days off. And that communication that Maria talked about, because we're human beings as well. And so it's really super important to make sure that self-care is a part of your everyday practice. Next slide.
And so obviously we've talked a lot about this, but I can't stress this enough. And really, you can be responsive no matter the time frame that you have with that young person. And you're not going to get it right every single time. And that's something that you just have to live with, not because it's like, acceptance, but it's, again, having those conversations about what you didn't get right maybe is really important. So I was one of those kids that just really chose when to be challenging to people. That's like one of the ways that I took my power back. And I remember one time I was waiting for my TDM in Alameda County. Those are called team decision making meetings. And I was assigned an advocate without my knowledge. So somebody just showed up and say hey, are you so-and-so? She was talking to me in English, which was correct. I obviously speak English, but I was 15 at the time, and I was not the easiest I was to deal with right then. I was in the middle of experiencing really difficult things. And so I don't know why I just decided to tell this advocate that I didn't speak English, because I was trying to mess with her. And instead of that advocate getting frustrated or saying, okay, well, let's just cancel the meeting, she just said, okay, no worries, and went right to the front desk and asked for a translator. And she was like, I don't understand why this like child doesn't have someone to translate. And of course, I felt a little bad at that point because I thought that the person was just going to leave. But that has stayed with me for so long because what that showed me was what that advocate was willing to go above and beyond to make sure that I understood what was going to happen in that meeting. I still remember that, and of course, eventually, like, I came clean and told her that I actually did speak English, and she didn't get upset. She was just like, "Okay, I see that you're, like, just messing with me." She's, like, poking fun, and after that, everything was fine, but that's the kind of thing that, like, you want the kids to hear that you are rooting for them, and that you are gonna do what you can do in order for them to get what they need. Even when you can't get it, it's important for them to see that you're still trying. Next slide. Um, and then again, see the youth as a person first. Don't solely rely on exploitation. And one of the things that I have learned along, from being a direct service provider, my own experience, and also working in the policy field now is that labels can be really harmful. Like having a CSEC label sometimes can prevent you from getting the things that you need. And so making that effort to like not call children CSEC kids. And because sometimes the kids take on that level and they call themselves CSECs. Like we don't want that. We don't want that we don't want them to carry those things. And so we also want to make sure that we remind young people that they are whole people with dreams and with hopes and with wants, and that all of those things are valid. And so, as you noticed in the introduction, I didn't say right away that I had lived experience, and I'm very open about it, but it also took me a while to want to be in this space because I was afraid that I was going to be put in the box, even though I'm not experiencing this anymore. And that's the same for young people. We want to make sure that we address the young people by their name and not that CSEC kid. Next slide. And then lastly, there's always hope. As Michelle said, like I'm sure that she's, seen so many young people struggle, some young people that they've lost. I've lost a couple of young people that I was caring for also. And there's just always hope for as long as that young person is alive. And so really, I think that's the goal is to try to do what we can to make sure that that young person lives. And inevitably, this is kind of like a downer, but we don't have control over everything. And there are so many young people that need to be served in this way that to me that always speaks for hope. And I also remember like there's been times where I've gotten like, random calls from kids that I served a long time ago and just said, either a thank you message or a hey, guess what? Like I got married or I finally got my GED or I have a baby now, like all of those things that mean so much because like who am I for them to like remember me? And like it just shows that like in some way or another I made an impact. And I think you all having an opportunity to make that impact is just worth all of this. And that's our emails. Feel free to reach out.
Thank you so much. I think I'll hand it over maybe to Alex and Victoria, see if there's any questions that have come through. I haven't seen anything specific in the chat yet.
Sure. So I just want to say, Maria, Michelle, and Carly, I am in awe of you all. You really live this work, and that is so evident in the examples that you presented and in the strategies that I think you've demonstrated here. I think one of the biggest takeaways for me is just the importance of relationships and celebrating those milestones and really proving that probation doesn't just need to be supervision. In fact, it shouldn't just be supervision. It should be support. And I think that goes beyond just the, supporting survivors of CSE. I think it really speaks to all kids who are involved in the youth legal system. So I just want to thank you so much for your dedication to this line of work. I do want to open up the floor if folks have any questions. Victoria, I'm not sure if you received any questions in the chat. Let's see. It looks like we've got one person who just put a comment in here.
So if I can jump in and then I'll definitely pass it over. But So you're talking about running away or, essentially leaving care without permission, which is something that's incredibly challenging and very common in this work. We actually have done a lot of work digging into this, and I'll drop some additional links to some other reports that might be helpful. But I think I'll just say one thing and then pass it over is that we are often blaming kids for them, running away or, something, not engaging in service or something. But if a youth is leaving care, there's something that they're not getting from that place. And we need to be focusing on what is not going well there, as opposed to blaming the kid for leaving. So I'll just say that, and Michelle or Maria, if you want to add.
Mm-hmm. Michelle, you want to go first?
Yeah, I was just going to say one of the things that we did kind of under the harm reduction guys is that we really, through those relationships, always talk to young people, especially in safety planning or the team, is that if you get the urge to run, call us. Let's try to talk, right? And if it was at nighttime hours, like 10:30 at night, we tried to ask the young person, can you wait until it's daylight tomorrow morning, then go? You know what I mean? And because again, talking about the risks of running in the dark versus running in the daylight. And sometimes our kids would stay and agree to stay till the morning, and some of them would run. And some would say, okay, I'm fine, I'll just stay here. You know what I mean? So kind of use it both ways, but trying to see if we can do some of those harm reduction things. And if you're going to run, try to run during the daylight hours and not in nighttime hours. So just using some of those kind of things, not to say don't do it, try to talk you totally out of it, but if we're going to do this, and then continue to communicate safe places, safe people, whatnot.
Mm-hmm. The other thing I'll add is that we've also heard from young people that they actually do tell people when they're having the feeling of running away, and they're all oftentimes precursors to that. So a young person saying this isn't meeting my needs, I can't go see my sibling. We've even had kids say I can't even go to school because I haven't been moved, or transportation hasn't been happening, and so they leave for school and then they come back and their bed is closed, and I'm like, this kid wanted to go to school, this is not the way to do this. So really listening and asking and trying to figure out how to manage those triggers, and figuring out if there could be something that could be done with placement staff or wherever the young person is leaving that could improve the reasons why they want to leave. And also in line with harm reduction practices, I know that the cell phone conversation is difficult, but I would rather have a kid take a cell phone with them so they can call someone, so that they don't end up running away to their trafficker and then being isolated. You also want to make sure that they have other things with them that they need. So condoms, a bus pass, so they're Clipper card, things that they're going to need to get around, and also the phone numbers of I always urged the kids, whenever I changed my phone number, I'd pick one that was really, really easy to remember so that the kids would memorize it. And they didn't have the risk of having a card with my phone number on it that somebody could see, because that's also risky for them. So just making sure that you're talking to them about what's realistic to manage some of those risks. And also when they come back, celebrate that. Thank you so much for coming back. We all care about you. What do you need right now? Are you hungry? Are you thirsty? I would never force a young person, but I'd say I think it might be good idea to go to the doctor and just get yourself checked out. Why don't we go do that?
I love that. That's so great. Not only the way that we respond, but being proactive with those strategies as well. And again, the theme that I keep hearing from you all is just that investment in young people and letting them know that they are really worth that investment and that you're there for them. We do have about 2 more minutes left. I want to see if folks have any other questions. There's a lot going on in the chat. Jennifer Stein, I see you mentioned CASA, court-appointed special advocates, who really are so instrumental in the lives of young people. So thank you for raising that. May, I see that you've got a comment in here as well. So I do want to feel free to come off mute or put a question in the chat if you have one before we wrap up. And I will add, and you'll see the comment here from Victoria Chamberlain, there will be a third a third webinar in this series, and that's taking place on May 14th. There's a link to register for that right there, and we'll also share that link with you by email along with this recording.
And please feel free to reach out to any of us if anything comes up later or you have any questions about the resources that we've shared with you. Just want to say thank you so much to everybody for joining today.
Yes, and thank you, Michelle, Maria, and Carly. You all are absolutely amazing. You're inspiring, and I'm looking forward to continuing to learn from you. So thank you for spending your time with us today here, everybody. Take care, and we'll be in touch.